The following events were recorded as they happened at the Hospital for Sick Children in Toronto. On this episode of Life's Little Miracles, Grace faces her second brain tumor operation. Stephen makes his first trip to the ER. Maria needs surgery to end her eye infections. And expectant parents Trevor and Rebecca prepare for surgery for their unborn baby.
I held a newborn on Saturday and there's so little, what, to put them through surgery in the first week,
Their healing is better than yours and mine.
Trevor and Rebecca are expecting their first child in 4 months.
Dr. Gershel at 11.
3 weeks ago, a routine ultrasound revealed a rare genetic birth defect called an omphalocele.
Yes.
The baby's abdominal wall has failed to close, leaving a sac of vital organs protruding through the hole. If the baby is to survive, it must be transferred to the hospital's neonatal intensive care unit to prepare for surgery to repair the defect.
So you may have a seat in room 11, first door on the left. Thank you.
I'm in my 21st week right now, and I went for the normal 18-week ultrasound, and we thought we were going upstairs to the doctor to find out the sex of the baby, so it's good that we didn't know what was going on, but we got up to see my obstetrician, and he informed us that they noticed a small omphalocele, and so it's been about 3 weeks since we've known.
Trevor and Rebecca meet the surgeon who will operate on their baby's omphalocele.
Omphaloceles are in the spectrum of abdominal wall defects that babies can have. So the baby's born and we'll assess the lung function, we'll assess the heart function. The baby will get fully assessed to make sure there aren't any other abnormalities. And then we'll move on to assess how big is this. Now, if it's really a small one, so there's usually enough space in the abdomen and there's not that much outside that actually not only can you bring the skin over the top, you can bring the muscles together as well.
There's nothing I can do to control this or contribute to this or
Zero.
There's nothing I can do to help minimize.
It's nothing that you did, nothing that you can do.
This is our first child, so I held a newborn on Saturday and there's so little, what, to put them through surgery in the first week,
It's remarkable the tolerance that children have to surgery. Their healing is better than yours and mine. Their scars are better. It's just amazing.
Can you give them pain medication and stuff?
Absolutely. So they would be treated the way you and I would be treated. They're treated as aggressively and as similar as to adults in terms of narcotics and nutrition.
Well, this has been really, really, really helpful. You just build all these questions, and I don't know. There's so many what ifs, but
and that's a hard thing. And we tried to eliminate as many as we can. And we wish we could eliminate all of them, of course.
Great.
Thank you very much.
Okay, nice to meet you.
Thank you very, very much.
We'll talk later.
Rebecca's pregnancy will be followed by specialists for the next 4 months. Over the past year, 3-year-old Maria has been hospitalized 7 times because of severe infections in her left eye.
Hi, sweetie.
Doctors have determined that the infections are caused by tear ducts that do not drain properly. If left untreated, Maria could suffer permanent damage to her vision.
Oops.
Today, Maria's ophthalmologist hopes to create a new way for tears to drain from her eye to her nasal passage to save her from further infections.
How are you, Maria? Can I take a look at your eyes?
You have to look at Dr. DeAngelis and let him look at your eyes, honey. Remember, we're going to go and get your eye fixed.
Well, as we said, there'll be a little tiny cut on the side of the nose.
Okay.
It's going to take away some of the bone, and then we'll reconstruct the tear duct.
Okay.
She'll have some tubes in there afterwards, and they usually stay in for a couple of months.
Yeah.
The tubes are really there to allow the entire tear duct system to heal around it.
Right.
We'll remove them in the office in a couple of months. They're not that difficult to remove.
Okay.
And she should notice them. They'll be kind of buried in the corner of the eye. And she'll have some stitches there which will dissolve on their own afterwards as well.
Okay, so she doesn't have to get them removed then?
No.
They'll dissolve.
Yeah.
Okay. This is really bad. You can feel your back.
Are you cold?
I'm not tied up.
Okay,
Not
mommy,
tied
I'll
up?
tie
Okay,
you
mommy
up.
will tie you up. Okay, we'll see you in a little bit.
All right. Thank you very much.
Maria's tear duct repair is minutes away. 4 months after their first appointment with a surgeon, Trevor and Rebecca's first child has been born at Mount Sinai Hospital's high-risk birthing unit. While Rebecca recovers in Mount Sinai's maternity unit, Trevor accompanies his daughter Isabella through an underground tunnel to the hospital for sick children.
Oh, bed's nice and warm. All right, sweetheart.
Baby Isabella has been born with an omphalocele and is admitted to the neonatal intensive care unit.
We can take these now, right?
She needs a physical to ensure she is stable enough to handle the surgery she needs to place her organs inside her body and close the hole in her abdominal wall.
I think we got 35.
An IV has already been inserted into Isabella's hand to keep her nutrition and fluids up in anticipation of the surgery.
Just going to take her temperature. Sometimes newborns can get cold, and particularly she can get cold because she's got a lot of her inside out, right? So she can drop her temperature that way. She's fine. 37.3. Just going to take her blood pressure. All right. How's Mom doing?
Good.
Yeah.
Yeah, she's doing well.
Okay, good air entry, both lungs slightly diminished, lower left. That's normal because this will be pushing, her lungs will be a bit small and everything's pushing around. So we'll pay attention to that over the coming hours and days, just to how well the air is getting down into the bottom of her lungs. Okay. But she's looking good. She's nice and pink.
Isabella's vital signs are stable.
So I'm going to let the doctors know that they can come and examine her and admit her.
In just a few minutes, only 1 hour after her birth, Isabella will have her first appointment with a surgeon.
Hi, baby.
It's time for Maria to be taken to the operating room for her tear duct repair.
See you later, Daddy.
Her mother will stay with her until the anesthetist has put her to sleep.
Everybody ready? Now we're going to bring a mask. It smells like bubble gum. I have a hunch she's not going to like it very much. So we will help you hold the mask, but if you just bring the mask to her face to begin with, it'll probably take about a minute for her to actually go to sleep. Everybody ready? Just going to go scoop and go here.
Okay, sweetheart. It's okay. You see, it's a balloon there.
You hold a hand, Emily.
Yeah, it's all right. Here's Mommy, okay? Mama's right here. Mommy's right here. Maria, Mommy's right here, honey. I'm right here. Take good care.
Now that Maria is asleep, her tear duct repair can begin.
15 way? Just like it on this one.
The surgeon's first step is to make an incision in the side of Maria's nose.
So we're dissecting down to find the tear duct sac, and I'm just pushing it off to the side here so I can get access to the bone. And it's this bone that we're going to make a small hole in that'll allow us to connect her tear duct sac to the lining of the nose to make the new tear duct for her.
The tiny hole in Maria's bone must be created slowly and meticulously by hand to avoid damaging the structure of her eye and nose. Isabella's surgeon has been alerted to her arrival in the neonatal intensive care unit.
Just kind of sneak in and see where they're at.
Okay. Back up there.
He now has his first opportunity to examine the omphalocele and make his surgical plan.
Have you seen it?
Yes, at the
delivery.
Didn't bother you too much?
No, no, it was actually not as alarming as I thought. So.
The intestines are in there?
Mm-hmm. Is that the umbilical cord?
Yeah, those are the normal vessels. They're going up to the top. Yeah. They just get stretched. I usually don't get to see that much. You see the three of them? Mm-hmm. The arteries and the veins. I don't see any liver in there. So what we need to do then is we go in and open this up a little bit and then squeeze everything in here back into the abdomen.
Mm-hmm. Is she in any pain from this right now? Or?
Well, I think probably moving around is not too comfortable.
No.
But no, she shouldn't be in that much discomfort at all.
Okay.
Isabella's life-saving surgery is 18 hours away. Isabella's mother has been discharged from Mount Sinai's maternity unit and is reunited with her one-day-old daughter.
Another big day. As though being born
2 big
isn't
days
enough.
in a row, yeah.
Isabella is on her way to the operating room, where surgeons will attempt to fit her protruding organs inside her body and close the hole in her abdominal wall.
Big day. Good luck.
Okay? We'll take good care of her. Okay?
Thank you.
Thank you very much.
While Isabella is anesthetized, the surgical team reviews the procedure.
We're going to first open up the sac and see if we can push everything back. Sometimes the bowel's stuck to the sac, so you need to peel it off a little bit. And we inspect the intestines to make sure there's no abnormalities in them. And then as we push it back, we'll chalk the anesthetist to make sure we're not pushing too much pressure on the abdomen and make sure they can still ventilate well. And then we'll close up the abdominal wall and the skin. Hopefully that'll all go pretty smoothly.
The team's first job is to carefully squeeze Isabella's organs back into her body.
Priscilla wants to see if she can squeeze it back and it's not stuck. So we're going to give Priscilla that opportunity.
It's possible that Isabella's abdominal cavity may be underdeveloped and too small to hold her organs.
It is well.
If that's the case, the procedure will be aborted, and doctors will protect the organs in a plastic pouch until Isabella grows.
That's exactly it.
This could take weeks. It's been 2 hours since 3-year-old Maria's tear duct repair got underway. Maria's doctor has successfully created the tiny hole in the bone in her nose and opened her damaged tear duct sac to create a new drain for her tears.
So now we're about to make our cut into the lining of the nose. As such. So now we're going to pass the silicone tubes into the nose. Take the Flymodexin back in. So now the tear duct is effectively reconstructed. And we're going to start to close the wound. Great. Well done. All right, so we're all done. She's awake. Everything went perfectly well. Could not have gone more smooth. So we opened up her existing tear duct, made a nice big opening. She has some silicone tubes that are now in the nose. So when you open her eye, you might see a little tiny end of a tube there, but the ends of the tube is actually down here towards the bottom of the nose. Okay. So that'll stay in for a couple of months.
Is there anything that we have to do in terms of keeping clean?
No, just the ointment, as we described, 4 times a day, and the drops 4 times a day. If she has a little bit of a nosebleed, that's fine. Just put some pressure on it. If it's really, and it shouldn't be uncontrollable, but if anything happens or you're concerned, don't hesitate to contact us. Okay?
All right, thank you very much.
Okay, you're welcome.
Thanks.
All right, see you next week. Okay, bye-bye.
Okay, thanks. It's okay, Pupa. It's okay. Mama's here.
Maria will be discharged later today, as soon as she recovers from her anesthetic. She will return to the hospital for a checkup in 1 week. 4-year-old Stephen has been brought to the hospital's emergency room after hitting his head against a table.
Hi, is this Steve?
Yes, it is.
Hi, Steve. I'm Dr. Park. Nice to meet you. You're Steve's mother?
Yes, I am.
Hi, Randy Park.
Lisa.
Nice to meet you. I'm one of the emergency medicine residents working here today.
Great.
Okay. So I heard Steve had a fall today.
That he did.
Okay. When did that happen?
Approximately 10 to 6.
10 to 6. Okay. Steve, where were you when you fell today?
In the living room.
In the living room?
Yeah.
Okay. Did you trip, Steve?
No, I banged my head like that.
Oh, okay. On the ground?
No, on the table.
On the table?
Yeah.
Okay. Does your head still hurt right now?
No.
No.
He was running around the coffee table, and he did a face plant into my table, which just happens to be solid marble.
Okay. And you heard him cry
Oh,
from
yeah.
the kitchen?
Yeah, my husband got up and
Mommy,
went right in there.
Mom.
Yes.
When you were sleeping upstairs and it was morning and we get up and they tell me to go on a foot and sneak for candy.
Well, you don't need to sneak for candy, and don't listen to your sister.
Okay.
Yeah.
Just taking a look here, it looks like it's not going to require stitches.
Okay.
Looks like this is something that would heal well with skin adhesive, basically crazy glue for the skin.
Okay.
So I'm just going to step aside. We'll get some of the skin adhesive that I was talking about. Okay?
Okay.
And get this cut closed.
Great.
Okay?
Okay, thank you. You're gonna get your boo-boo fixed? Yeah.
It's been 1 hour since 1-day-old Isabella was taken into the operating room. Her doctors have successfully moved her intestinal tract into her abdominal cavity. The team now attempts to make her a navel.
I think they should have a belly button making course for pediatric surgeons. It's really in the aesthetics of what you think a belly button should look like. Looks good.
Oh, hi.
So everything went fine.
Okay.
Isabella has a nice belly button. Everything squished back okay.
So everything went in.
Everything went back. Her pressures when they put it in only went up a little bit. And the pressures.
And that's to be expected.
That's to be expected, so they didn't go up a lot. So it was reason for us to push everything back in. And she's doing very well.
I guess the concern now is just how her digestive system is going to be working.
Correct.
And
So we'll wait for the nasogastric tube drainage has to drop off and not be green anymore.
What's that, sorry?
The tube in her nose
Okay.
it has to be not green, so no more bile in the tube.
Okay.
So that means the bile is going down the other direction, and the fluid volume has to be low, and she has to start pooping, of course, on her own. We'll see you
That's
later.
great.
Have a good afternoon. Okay, bye-bye.
Thank you.
Bye-bye, sir.
Bye-bye.
Bye-bye, Mia.
Isabella has been transferred from the operating room back to the neonatal intensive care unit.
Oh, she looks totally different.
Isabella has shown great strength coming out of surgery. But her parents won't know if the procedure has been successful until she begins to eat and her intestinal tract begins to work.
Steve, I want you to lie down with your head this way, and you can actually bring your feet all the way up onto the bed here.
Back in the hospital's emergency room, Steve's doctor is ready to treat his cut eyebrow.
Mom, can I ask you to just grab a Kleenex from the box sitting on top of the counter there? Great. And I'm going to actually ask for your help while we do this. Steve, your job is just to keep your eyes closed for 1 minute. Your job is to just place that over his eye. Okay? That's it.
Don't open your eye. Keep
Okay.
it closed tight.
Just to make sure that none of it drips down.
Keep it closed, Stephen. Good boy. Almost done, buddy.
Okay, so the skin edges are together now. The width of the cut is just going to be the width of the scar that he's left with. And the last thing is just a Band-Aid.
Thank you.
Any questions at all?
No, not at all. No, I don't think so.
Okay, so Steve,
I just want to make sure that it's stuck together because it
is stuck together.
Okay.
So none of that's coming apart. You shouldn't see any more bleeding from here on in. All right, Steve, you did a really good job here.
What do you say?
Okay.
See? That's all fixed. Yay, we're done.
It's been 3 days since Isabella had surgery to move her intestinal tract into her abdominal cavity. Isabella continues to grow stronger and is ready to have her breathing tube removed.
Oh, yeah. Okay. There you go. Okay, I got her. You got her? Yep. You're going to feel a lot better once we get that out of your nose. Okay, sweetie. Okay. Never mind once we get you all nice and happy. Yeah.
And she's had her lip kind of taped up too, so it'll...
Okay. Okay, look good, yep. Okay, okay.
The breathing tube is out.
Okay, we got a little cry.
Isabella is successfully breathing on her own.
More booger. Okay, good.
She is one step closer to discharge, but continues to need the nasal gastric tube to suction bile from her stomach, and is not yet eating on her own. Four years ago, 14-year-old Grace Heron was diagnosed with a benign brain tumor and underwent a successful surgery to remove it. Now, another tumor has been discovered, and Grace faces a second brain surgery.
Are you going to take your dog in with you this time?
Yeah. He's in my bag.
Her family hopes that this tumor will also be benign.
When they took the tumor out, a little tiny piece of it was left behind, so tiny that they couldn't even see it. So that's what they're going to remove today. They picked it up on an MRI. There were no symptoms for this one because it was in a different spot than the last one.
So they've been doing MRIs over the last 3 years, like on a regular basis, and that's how they picked this up. So.
Grace and her parents meet the neurosurgeon who will attempt to remove the tumor.
Thanks for coming in today. Okay. How are you feeling, Grace? Great.
We've had a chance before at length to talk about Grace's situation. You know that a few years back we had removed this very large craniopharyngioma. It's the tumor that was found around the pituitary gland and the optic nerves, very delicate location. We were able to remove it successfully. We're very happy with how Grace did after the surgery. It was a very complicated surgery. It took us about 8 hours, as you remember, or more, to do that big operation, but Grace came through it beautifully. And for the last many, many scans, she's been great. And then I guess about 3 to 6 months ago, we noticed this change, and there was evidence of a new growth that was occurring in a slightly different location this time. We still think it's craniopharyngioma. We don't think it's anything other than a recurrence. It's a cystic recurrence, which is good news too. It's not a solid recurrence, so I think we'll be able to free it up and get it out of there very, very easily.
Do you do a biopsy on it when you take it out as a matter of course, or?
We'll certainly take specimens at the time of surgery. Looking at it, I can't imagine it being anything else but this. Okay. But if it does look suspicious for something else, I will take a biopsy and give it to the pathologist who can render an opinion for us as to what it might be. Okay. As far as the exposure, the skin incision will be similar. As far as the risks go for surgery, we talked previously that she might get an infection in the skin or the bone or even the brain fluid. That's something we can treat with antibiotics. There's a risk of bleeding that would require transfusion. I think that's pretty low risk. And I think those are the main issues. I'll see you downstairs.
Okay.
Good, thanks. You're welcome.
It's time for Grace to say goodbye to her parents and go to the operating room for her anesthetic.
So, hugs and kisses or high fives to mom and dad? Yeah?
Okay, see you later, sweet pea.
Love you.
Love you too.
Bye, Dad.
Bye.
Love you.
I love you too.
So just give me
You'll do
about
great.
an hour and a half.
Okay. All right, let's go.
So,
Here we go. Here's everybody.
doing? You okay?
Yeah.
Feeling good?
Yeah.
Outstanding. You don't seem nervous. How do you do this? Huh?
I don't know.
Yeah. So you're going to be a neurosurgeon?
No, I can't do with blood.
Oh my goodness. What would you like to do?
Work with animals.
Oh really?
Train animals.
Yeah.
Stuff like that.
Do you have any pets?
Yep, I have 2 dogs, a guinea pig, a cat, and a horse.
Well, we're waiting for you to go to sleep, so could we get on with this? Huh? You're a teenager. You're supposed to be asleep. Oh, well, it's been nice talking to you.
Nighty.
While Grace's breathing tube is inserted, her neurosurgeon reviews CT scans of her brain tumor.
And here now you're seeing a small tumor that's been growing in this region right here, just behind Grace's eyes, and it has the same look and consistency as her original tumor. So we think this is what's called an ectopic craniopharyngioma. That means that a tumor that has arisen probably as a result of her original surgery, and a small tumor seed or cell was deposited in this location upon removal of the tumor and has set up as an independent growth and tumor at this stage. On the coronal scan here, you can actually see the tumor in its location. Here's Grace's right eye, and here's Grace's left eye here. The tumor is now sitting quite squarely between the 2 eyes in the midline, very far forward. And today's goal is to come in here and remove this tumor, and again to make her tumor free.
Grace is now anesthetized, and the surgery gets underway. The team's first job is to reopen Grace's scalp along the scar from her previous surgery to expose her skull.
Stay in the old incision. I'm going to start to drill some holes that we can use to have access then to the dura, which covers the brain, then open that, and then we'll get closer and closer to the tumor itself. The tumor is sitting as a round ball right here, but in about 2 or 3 centimeters. Right in the midline, slightly off to the right side. The hole can go here. Can I have the pencil again?
The team has made its surgical plan and will now begin to drill into Grace's skull to prepare to expose her tumor. The drilling must be done with great sensitivity to avoid catastrophic damage to Grace's brain. "14-year-old Grace's brain surgery has been underway for 3 hours. The team of neurosurgeons uses microscopes to carefully expose the tumor.
So we're just now on the dome of this tumor. We're going to be exposing it all the way from front to back. It looks bigger than I thought it was going to be, but maybe it has grown a little bit since even the time of her last scan. We're going to cut into it. I make like a rectangle in it. You're going to see a gush of fluid, I think, because I don't think it's all solid here. Okay, so there's the fluid coming out.
Pick up the piece, please.
See how it's deflating now? Like a balloon opened up into it. And it's still a bit of a pedicle, but we're getting close to having this thing out. Okay, you guys can see that now coming out and almost have the whole thing out now. Okay.
Oh, wow.
The tumor has been removed, and it looks benign. The team can now begin to close. Grace's brain surgery will then be complete.
Hi guys, hi, how are you?
Hi.
So you can see we're done a lot more quickly this time than last time. I think it had actually grown since the December MRI scan, because it was certainly about the size of a golf ball today, it looked like. So I think, as we said, it was a good idea to go ahead and take it out, because it was certainly growing, and we knew that it was going to continue to do so. Right. It was filled primarily with fluid, craniopharyngioma cyst fluid. So we punctured into the cyst, drained it, so deflated it, and then worked our way all the way around the entire capsule until we got a complete resection. So I'm confident that we got the whole thing out of there.
Okay.
But everything went just basically according to plan.
Okay.
All right,
Thank
guys.
you so
Okay,
much.
all right, guys.
Thank you.
We'll talk to you soon. Thanks.
Grace has been moved from the operating room to recovery.
Has she been awake?
Hi, Grace.
Grace.
Are you awake, honey?
Hi, honey. Congratulations.
Everything went well.
You feel tired?
Still sleepy? A little bit?
Does it?
Your head hurts a little bit? Yeah. So you can have a nice sleep now, eh? Okay.
Back in the neonatal intensive care unit, Isabella's surgeon checks in on her during daily rounds.
Good morning. Hey. So I heard you get the tube out.
Yeah, and it's been about half an hour maybe, and it's so far so good.
So far so good.
I heard her for the first time since when she came out.
You mean in terms of making a squeak?
Yeah, and just trying to cry. She's obviously a bit hoarse.
Yeah, she's going to be hoarse for the tube, for sure.
Yeah.
Just had a little look at her tummy.
Yeah.
I noticed we took the bandage off yesterday.
It's not too bad. It's kind of okay. I know. I'm sorry, sweet pea. We'll cover you up. Stay exposed. No, things are working pretty well.
So the next major milestone is to conquer is really feeding and gaining weight, right? Like
correct.
that's.
So we'd like to see, get up to full feeds, and she weighs. So in kilos, about 2.5 kilos. So roughly that's 12, 15 an hour would be her goal. Or if she's fed every 3 hours, it would be 45.
Okay.
So about 1.5 ounces to 2.
Okay.
We'd like to see. And she has to gain weight with that, of course.
Okay. Great. Well, thank you.
You're very welcome.
Much.
It's been 1 day since Grace's brain tumor was removed.
Hi, Grace. Good morning. Hi, Mom. How are you?
Hi,
Nice
good
to see you
morning.
this morning. Yeah, good. How you doing?
Very good.
Yeah, you look great.
Thank you.
I couldn't believe how nicely you looked even last night after the surgery. Do you have much of a headache today?
Yeah, a little bit.
Where do you feel it? Is it up front or the whole head kind of hurting you today?
Kind of on the sides.
Is it?
Yeah, but it's very faint.
Good. Okay, now let's do some stuff. Can you see my fingers? Look over this way. And over here. And up to the sky and down. Okay, how about give me a little squeeze here? I know you got your IV here. Oh, that's excellent. Great first post-op check. Looks wonderful.
Grace is taken for a CT scan to ensure the surgery has not caused bleeding, which could damage her brain by creating dangerous pressure spots.
Okay, sweetheart, the table's just going to move in, okay? Here we go.
The CT scan will also look for evidence that any tumor has been left behind to try to prevent a third recurrence. One week after her tear duct surgery, 3-year-old Maria returns to the ophthalmology clinic for a checkup to ensure there are no signs of post-operative infection.
So, how are we doing?
I've been taking the patch off at home, but when we go out to keep it clean,
Sure.
There you go, Boo-Boo.
So there's still a little bit of tearing?
Lots.
Lots? Okay, that's
Yeah.
normal.
There's lots.
Let me turn the lights out for a second here.
Yeah. Okay, put your chin up. Put your chin up.
It's okay, sweetie. Well, the wound looks great. The black and blue is completely normal.
Yeah.
That usually settles down within 10 to 14 days. The most important thing is the wound is nice and clean. There's no evidence of infection. The tube is still in the corner. Good. We won't know the final results until we take the tube out.
Okay.
So it's completely normal. That doesn't surprise me.
Great.
All right.
Yes.
Okay.
So thank you very much.
Like I said, the tube stays in for 3 months, so we have to wait until 3 months before we take it.
Maria will return to the hospital in 3 months to have the tubes removed. Only then will her parents know whether the infections that have threatened Maria's vision are gone for good. 2 days after her tumor was removed, Grace faces what she's been dreading most. Her head dressing and surgical drain will be removed.
Okay,
Right, so let me just put the bandage on first.
Squeeze me when you need to, okay?
So this is
That's
the
a big bandage, huh? Here, man.
Oh, you're starting to see your head.
Good.
I guess if your hair pulls, do you feel your hair pulling on it? Yeah. You got ponytails under there.
Yeah.
Yeah.
Can you try and lift your head up a little bit for me? Brilliant. Well done.
Very good, yeah.
Fantastic. Just going to get this little stitch that's holding it in place.
Yeah. Hurts. Can see you kidding? It hurts.
Just here where I'm cutting. Okay, so that's a stitch gone.
Oh,
Great.
there we go. There's a
Stitch is gone. Stitch is gone.
Okay.
Is you okay there?
Absolutely great, Grace. Okay.
Slow
So that's the last little
Yeah.
bit. So I'm going to gently pull it out. It is going to pull a bit as I'm doing it. There we go.
Good. See how
There we go.
it's stuff.
It's done. It is, yeah. So I'm just going to push on nice and hard. Okay. Well done.
Good job.
What a great thing you did, eh? Okay. Yeah. Yeah, it's all done.
Excellent. You did brilliantly there. So, all done.
Thank you.
After 12 days in the neonatal intensive care unit, Isabella is tube-free. She is feeding, and her digestive tract is working well.
She's doing really, really well. She started bottle feeding on Sunday night, and since then she's gradually increased to like her full feeding and is even taking more than that now. So she's digesting completely fine and eating ample, and she's gaining weight now. Her belly button is healing really well. It's just the stitches are slowly disintegrating, and it's almost looks like a normal belly button right now. So she's doing amazing.
Isabella is doing so well, she's ready to go home.
Thanks again.
You're very welcome. Good luck with everything, and you've got our number.
Yes.
But infants with Isabella's condition can have trouble continuing to gain weight. She will return to the hospital for a checkup in 3 weeks. It's been 72 hours since 14-year-old Grace underwent brain surgery to remove a tumor.
Hi, Grace. Hi. Good morning. How are you? Hi, Mom.
Hi.
Her surgeon does a final neurological exam to determine if she is ready to go home.
I'm just going to take a look at the wound now myself to see how that's looking. You know, that's a dissolvable stitch, right? That will go away over time.
Right.
And I think that looks really nice. I would say Grace has got a little bit of swelling over the forehead. Well, Grace, as I touch that, that doesn't hurt, right? Yeah. Here, that feels okay?
Yep.
All right. Okay, now look at my fingers up here. Look this way, and this way, and down, and up. Yeah. And we told you the good news again about the CAT scan being clear. Didn't look like anything was left behind, and so we're off to a great start. All right. Good. Anything else? Otherwise, we're really happy with her recovery since a big operation like this. She's been a true champ through it all, and didn't turn a hair. I mean, basically everything went really well. All right, and we're just a phone call away, right?
Okay.
Okay, all the best.
Thank you.
Take care. See you.
Bye.
Thanks.
Grace will be discharged later today. She'll return for a checkup with her neurosurgeon in 1 month. It's been 3 months since Maria's surgery. Today, the silicone tubes that have kept her reconstructed tear ducts open during the healing process will be removed.
Yeah, on my lap. There we go.
Hello, how are we doing? Good. How are you, Maria?
Mommy.
You
Dr.
okay?
Dina just asked you a question. How are you doing?
Can I take a look at your eyes?
Look up, Bumbo.
Maybe? Okay, lift up your chin for me. And do you see the tube in her nose?
Oh, yeah.
You
It's
do?
come out.
Has it?
Oh, yeah.
Do you have a little tube or a little worm in your nose? If we can get at the corner of her eye, it would certainly be very easy to do.
Are you
Okay,
going to
nice
let the
one.
doctor take the tube out? Okay, you suck your thumb. And let the doctor do what he's got to do. Done. Almost done. Good girl.
That was great, Maria. That wasn't too bad.
Blow, there's no more tube. You don't have to be scared anymore. Okay?
Do you want to see what the tube looks like, Maria?
Look, see? That's it.
That's all. It's all gone.
So see you, tube.
See you later.
Hope no more.
Five months after her tear ducts were rebuilt, Maria no longer suffers from eye infections that could destroy her vision.
Mommy. There's been no tearing. There's been nothing. Mommy. It's been really good. Everything seems to be going well. Finally, a happy ending, right?
Here, there's another propeller.
Isabella is now 1 month old. She returns to hospital to see her surgeon for a checkup.
Hi, Dr. Gerson.
How are you?
I'm very well, thanks. How are you?
I'm just going to turn on the light behind you so I can see things. So how have things been since you went home?
Things are going really well. She's at her last pediatrician appointment, which was 2 weeks ago. She gained some weight. She was at 6'8", so almost a pound more than when she was born.
So 6 pounds, 8 ounces.
Yes, and I think she had just gotten back to her birth weight, I believe, by the time she left here.
And now she's a pound over.
Almost a pound, yeah. She was 5'10" when she was born.
Let's have a look at her tummy.
Yep. Should I just put her on the table here?
Please, yeah, I'll be right there. Oh, these are good. These go all the way down to the bottom. The people who designed the other ones, obviously, never had a baby. That's going to look nicely, eh?
Yeah, it's doing really, really well. It's not red at all, or...
And you never had any discharge or infection when you went home?
Nothing.
Looks great.
It does.
Super. Well, let's wrap you up here. She's doing very well.
Well, thank you very, very much.
You're welcome.
No, we're very lucky. Everything went way better than we'd ever anticipated.
Yeah.
And 3 months after her discharge from hospital, Isabella continues to gain weight.
You wouldn't know anything happened to her now after all that we went through, but we're very happy. Everything's normal and she's healthy, and
She's already doubled her birth weight in 3 months, which a lot of babies take 4 or 5 months to do. So it's pretty incredible.
You laughing? There you go.
Seven weeks after Grace's brain tumor was removed, she returns to the hospital to see her neurosurgeon to ensure she continues to heal well.
Hi guys. Hi Grace. Hi, how are you? Hi Mom.
Hi, how are you?
Good. Well, how are you feeling?
Good.
Yeah, great. How's it been since you've been at home?
Fine.
Any concerns for me to worry about? Are you having any headache or
No.
any problem with your vision?
No.
No double vision?
No.
Good. You had a little bit of, when you went home, you had a little bit of swelling over the front part. It looks like it's all gone. Does that feel pretty good now?
Yeah.
Excellent. Great. I just wanted to talk a little bit about your surgery a bit more, and also kind of illustrate it through the nice picture that your mother painted for me. I brought that up today. Is that okay if I do that? Oh, I've told your mother I think it's one of the nicest presents I've ever received, and it's a beautiful picture of you, Grace. In profile, this was the region of where your craniopharyngioma this time was located.
Right.
Previously, the craniopharyngioma, for whatever reason, was located back this way, and this time it was a nodule that had developed here. So we're very confident that that's all been removed. Oh, she's healed up beautifully then.
Okay. Yeah.
And 3 months after her second brain tumor surgery, Grace is looking to the future.
I'm working hard at high school, and I want to get to university. I want to go into dog training, I guess, and veterinary stuff.
She's in a good mood. She's got lots of energy, and she's doing really well.
We're very proud of her, the way that she's come through this and the way that she's handled everything. So.
I'm very happy. I love my life and all the things in it.
I love being with animals.